Hello, everybody. Wow, can't believe it's already been a week since our last Instagram live. I am going to be doing today on why you should go with a medical professional rather than anyone else. So, I'm just waiting for my colleague Natalie. Should be able to join in any time now. Oh, yeah, I did it.
Well done.
Oh, I had like a moment where I thought, oh no, maybe we should have checked this out before starting.
Bless you. Yeah, the thing is, I've done that before and I've checked it out beforehand, and then even when I've come to do it, they end up changing the settings or they do something new. So yeah, no, you did it. Well done. Sorry, I'm still at work. Literally
That's all right.
just stopped.
Oh, thank you for joining us. So as some people already know, we'll just both introduce ourselves. My name's Dr. Victoria Blackaby. I'm an NHS doctor specialising in ears, nose and throat surgery, but now also facial plastics, and I'm running my clinic in Yorkshire. And Natalie, I'll let you introduce.
So I'm Natalie. I'm a nurse prescriber by background. I've been trained in aesthetics for nearly 7 years now. Teach at Harley Academy, which is obviously where we met. And then I've got my clinic, which I'm in at the moment, in Colchester in Essex. So yeah, just here making sure actually I've got no Moroccan soup in my teeth, because I've also just quickly eaten that.
I do exactly the same thing, because I've just scoffed down a whole tuna sandwich, and then I found one little bit of tuna. I was like, oh God, I'm going to get rid of it before I come on.
I have bits of onion in mine, so hopefully I'm all right.
You look beautiful. Perfect tea.
So do you. So do you.
So
I'll leave it with you. We said we'd let you lead, didn't we? You can.
Yeah. What was I thinking?
It's quite nice, actually. I'm just going to sit back and.
Wow. Okay. See, this is the type of mentoring you get at Harley Academy.
Exactly.
So just run with it.
It's all about empowering people.
Yeah. Well, the reason I asked if you would join is because I think it's really important that people understand what we mean when we say why you should go with a medical professional.
Yeah, absolutely. And it's like we briefly said the other day, it's not about one profession being better than another. It's not about a nurse being better than a doctor, or vice versa, or a nurse being better than a non-medical professional. It's about why a medical professional is more responsible, more accountable. And I'm not saying that aesthetic doctors, dentists and nurses and clinical pharmacists are the best injectors in the world and the best practitioners. You know, we all have professions where there are people that aren't very good at what they do. Maybe I'm one of them, who knows?
Not you.
But it's about the accountability and the responsibility that we talked about that comes with the job, the extensive training that we do, you know, and it's like a lot of people say, oh, well, you know, anyone can learn that in a book. And like we said, it's not just about reading a book and doing an exam. It's about spending years, like you have and I have, working in the NHS, seeing necrotic wounds, seeing infections, seeing how to manage them, seeing what works, seeing what doesn't, seeing when it's outside of your scope of practice and you need help, and not just leaving people to deal with things on their own.
Absolutely. And I completely agree. There's some amazing aestheticians out there that are not medically trained and they do fantastic work. But the problem is that group isn't the problem. It's those that are advertising themselves as medically trained, doctor trained, nurse trained, when in fact they have no medical training whatsoever, and it can be really misleading to patients that they think, oh, I'm going to see a nurse. Well, no, actually, they attended a course, and that is completely different.
Yeah, absolutely. And if they haven't completed nurse training or doctor training, but equally there is something to be said for that very fine line where there are a lot of people that have trained to be a doctor or a nurse who aren't on the register, who aren't live, who aren't kept up to date, who advertise themselves as a medical professional, but they are not actually live, which means they are not on the GMC register for doctors, so they cannot call themselves a doctor. They may have trained as one, brilliant, well done. But if you never actually worked at one, and you're not worked as one, and you're not working as one now, same with the nurse, that is misleading the public, that's false advertising. In short, it's actually lying, and doesn't make you accountable or responsible, and that puts that poor patient in a really vulnerable position because they think they're getting something that they are not getting.
Yes, absolutely. And that's where it's really important for patients to do their research. And don't feel frightened if you are looking at a clinic and you think, oh, they look good. Ask them what their qualifications are. Ask them what their GMC license is. Ask them what because if they've got nothing to hide, they will give it to you.
I've been asked for mine. I'm sure you've been asked, what's your NMC number? I happily put mine on social media. People can check it, they can check I'm live on the register, they can check that I've got no restrictions to my practice, and that's also something else. People might be live on the register, but they might have restricted practice at the moment. They might be suspended, which means, are they safe to treat you right now? Probably not. Is it appropriate to? Probably not. Ask the question. If it's not a problem, like you say, you'll get the right answer. And if there's a concern over the answer, then the best thing to do is to pick up your handbag and go home.
Absolutely. I think there's got to be a level of just stepping back, reflecting on the situation and saying, right, is this a situation for me? Because both of us have governing bodies. We are accountable. We are insured. We are insured for complications. We are able to deal with those complications and recognise them. And there are people out there that do say they're medically trained when they're not, or they're misleading in some different way, and that can lead to having an amount of trust in that clinician that isn't actually appropriate.
Yeah, it's complete mistrust, and there's another thing that you touched on with about insurance. You'll see people a lot of the time say, oh, well, I'm trained and I'm insured. Yes, at the moment, legally, you can do a one-day course, and that means that you have a certificate in a certain amount of training. Doesn't necessarily mean that you're trained in all the areas that you need to be. So again, it's what are you trained in? How much time did you spend doing that? Where did you do that? Who was that with? And then insurance-wise, there's a big thing like we said about with insurance saying, oh, you know, I'm insured to manage any problems. But lots of practitioners aren't insured to manage complications. So they might be insured for themselves, but they're not actually insured for you or any onward referrals for any specialists that you might need. If things don't go to plan, and they don't go to plan with medical professionals, there is always a percentage, isn't there, of things that happen. And we do a thorough consultation and assessment to make sure that people are suitable for the treatment and to hopefully avert any risks or complications by doing a thorough assessment. But sometimes they do happen. And they need to be managed, don't they? And the patient needs to be supported, and they can't be if the insurance is not full insurance that covers everything that that patient needs. So I've even been asked, a patient even asked a couple of years ago to see my insurance policy. I was like, absolutely, I'll get it out for you, it's not a problem. I said, I can forward it to you on email if you want. Not a problem. Because they wanted to make sure that I was insured appropriately for what I was recommending them to have done. So yeah,
I think I like yourself, Natalie, I'm very open. If anybody's got any questions about my insurance, what I've done, whether I have had complications, I'm very open with it. And it's the same with my practice as well. If you're operating day in, day out and you've never had a complication, either you've not operated enough or you've never followed your patients up.
And you don't know
somewhere else. So yeah, absolutely. I think patients really need to be clued up at the moment, especially with the lack of regulation of exactly what they're going in for, and make sure they're having that cooling off period. If they're not sure, say you'll come back.
Absolutely.
Don't feel pressure.
And that's the thing, and ideally there should be a cooling off period. And sometimes patients say, oh, can I book in? I haven't had anything done. And I say, well, let's have a consultation. You don't need to book to have anything done today. It's a no obligation consultation. And equally, I don't want to book out time if you're not sure and then rush a procedure. It needs to be a separate consultation, a discussion about the risks, what concerns you, making sure that I'm the practitioner for you. It might be, as you know, that sometimes someone will come in and you think, do you know what, I don't think I can meet your desired outcomes. You want a certain aesthetic look. That's not the way I practice. That's not what I do. And I've had people say to me, yeah, but I want you to do it anyway. And it's like, no, but I don't want you to walk around with that overfilled result, because that's not what I do. And, but you're safe and you're trained and you're this and you're that. Yes, I am. But then you need to understand that I'm still not going to treat you because there's a different desired outcome there.
Sometimes one of the most wisest comments I ever got from a surgical consultant colleague was, what makes you a good consultant isn't your operating, it's when to say no.
Yes, absolutely. Yeah, definitely. I completely agree. I've said no quite a lot over the years, and we were talking about this the other day, weren't we? And actually, I think those patients or clients have advertised me more than anyone else. Oh, I went to see Natalie and she said no. But then the people around them have thought, well, why did she say no? And she's clearly not in it for the money, which I'm not. She's in it because I enjoy it. I'm passionate about it. I like making people feel good about themselves. I like making them look better, whether it's medically or cosmetically or both. And sometimes they can be joined together. Sometimes people think, I've been doing a lot of blood tests here and people say to me, oh, what else do you do? And I think people just assume that, oh, it's just Botox and fillers. No, we treat medical skin, we treat acne, we treat rosacea, and sometimes we treat trauma, we treat asymmetry if someone's had Bell's palsy. These treatments can be used for so many things and they're so underestimated, but in the right hands with the right training can actually change lives. I've had people with traumas, with facial fractures that have got muscle twitches or asymmetry to their face, and people constantly look at them and go, oh, what happened to your face? Imagine that every day.
Yeah.
And then someone can tweak that and make it look more symmetrical and make it look more aesthetically pleasing and better for you. And then it helps psychologically not to be reminded of that as well.
Absolutely. And that's why in my practice, I have a full consultation for every single patient. It's an hour long. Yeah. Those lucky people, they get to spend a whole hour with me. And I go through everything. I go through the history, I examine, I analyse the skin. We talk about what they're looking for, because we've both got to be on the same page to move forward. And the problem is that a lot of people get their ideas of what they want from social media. And social media is not always the best place to do your research.
Oh, completely agree with you. And it's so hard because I used to share before and after photos, and people would email in and say, oh, can I have a forehead like this? Or, oh, can I have some lips like this? And my instant answer, which was so ethical, it was ridiculous. It was way too far the other way. Would be like, well, no, I'm really sorry, but that's not your forehead and I can't guarantee you'll get that outcome. And then they'd be like, but can you help with my wrinkles? Well, yeah, I can help with your wrinkles, but I can't guarantee that outcome. They'd be like, oh, okay, Nat, well, can I come in? And I'd be like, yeah, absolutely, come in, we'll have a chat, but I can't give you that.
Yeah.
And I'd always try to under-promise and over-deliver, because you're right, 100 people can have the same treatment and every single one of them will get a different result. And in 3 months' time, 6 months' time, 9 months' time, no matter what the treatment, they could all have it again, exactly the same, and their results will be different. The results are never exactly the same every single time. No. And I think, like we were saying with filler as well, sometimes I'll say to people, we recommend 6, 8, 10 mils of filler for full face rejuvenation, but we'll do it naturally, we'll do it gradually. And they look horrified. But 5 mils of Calpol is a very small spoon, and if you sprinkle it around the areas of the face, it can go unnoticeable, you just look fresh. And it's that misinterpretation of how much gives you what. So like we were saying about lips, 1 mil of lip filler looks huge because we place it superficially. Yeah. People see these big swollen lips the minute after they're injected. You always see a before picture and a straight after. You never see one 4 weeks later. And when I started, I used to share pictures like 4 weeks later and be like, these are the healed lips. This is what they look like. And then I used to share pictures of this patient came 6 months ago, had her lips done. This is what they look like now, after that time, and she's come back to have them done again. And while they were really helpful, and they are really helpful, and it's good for people to see, I found for me it was more helpful to sit and talk to them. And obviously there's a big thing about social media and before and after photos, and I wrote an article about it a few years ago for the Aesthetics Journal, and I can see why people share them, and it is good for practitioners to be able to show their work. But I just found for me that I thought, you know, I found more people were like, oh, can I have this, can I have that? And I found like it was a harder discussion to have, trying to get them to understand that that might not happen. Does that make sense?
It does. I rarely show results. The only ones I really show is if I've dealt with acne or rosacea. And even then, I still say, everybody's face is different. Everyone's anatomy is different. You can have so many different factors, whether that be gut health, hormonal changes. All of that plays a part, and that's also why medical professionals are able to address all of that, or at least put you in the right direction to get that addressed.
Exactly, and I think, you know, if you're sharing that and you're saying that, and then that patient understands that, then that's fair enough. I think the problem comes, like you say, is inappropriate marketing, not just of people's professional status and their qualifications that they hold, but what they are presenting to the public without the information that's required. But with the information of everyone's different, you know, we can't guarantee these results for you, but this is what can happen, is educational. You know, I do think there's an educational level for that, absolutely.
Yeah, and the other thing is always be careful with Instagram. You know, there's a difference between Instagram versus reality.
Yes.
Which I love, because even now I look all pristine, but if you looked outside, it looks like absolute chaos in this room. And it can be
mine does as well.
It can be exactly the same. It can be, you know, lighting, makeup, filters. You don't know what's been done to those pictures.
Oh, I've seen loads of pictures with filters on, and I'm like, there's a filter in that picture. How can you not see that? But equally as well, one of the things that we did pick up on when I wrote the article about it was a friend of mine, a colleague, a very well-known doctor actually. She is in Australia at the moment, who works in aesthetics, but an NHS doctor by background as well, had her before and after photos stolen. There's nothing to stop someone screenshotting your photos on your Instagram page, cropping them and sharing them for themselves. The other thing that I've found as well is you'll find some practitioners will reshare photos from 2 years ago. So it looks like they're actively practicing because that's a good photo and that will get some attention, but it's from 2 years ago. So those teardrops that you did 2 years ago, that's great, well done, great result. Have you done any more since?
Yeah.
And have you not had any good results? Because why are we sharing a picture from 2 years ago? You know, and it's good to reflect, but you've got to say that, haven't you? You know, you've got to be open, you've got to be honest, you've got to be transparent. And that is one of the things that we were saying about when you are a medical professional that is a dentist, doctor, nurse or clinical pharmacist that is on a governing body register, you have to follow those things. And if you don't, the outcome is you can be reported, you can be investigated, you could be struck off, you can lose your registration, you can never practice as a medic again, and you could actually ultimately lose your whole livelihood. And that's the difference.
And I think that's where, because I don't know if you've seen it well online recently, there's been a lot of information where people have been putting on advertisements on social media saying 20% off this, 30% off this, and quite often it's Botox, which you are not allowed to do.
No, because it's prescription-only medicines, right?
And so you will find professionals playing everything properly by the books, not doing it, but the general public doesn't know that then those types of adverts
and people have said
not
to me,
appropriate.
why are you so expensive? I'm not expensive. I do it properly. It is expensive. And if you do it properly and you source your products from an appropriate pharmacy or the toxin factory, and you don't buy them online from China, let's say, and you can't guarantee that they've gone through the auditing process and the process of the drug coming into the company making sure that it meets all the standard requirements. You haven't had the right training, you're not keeping up to date, you're not paying insurances. You know, people say to me, oh, you can get those wrinkle injections for £150. I go, that's nice. I go, if you actually buy a full vial, it's about £157. So how they're managing to light their clinic, pay themselves, buy needles is absolutely beyond me, which means that they are making a cut somewhere.
Yeah.
And we always say cheap is cheap for a reason. I do believe that. Sometimes though, cheap is cheap because, a bit like where I teach and you train, there is so many patients that we treat that you buy in bulk, and that makes a difference. So those things can happen, or ultimately you're paying to do your training, you are supplementing the price for the patient. Like, patients will come in and they'll say, well, how come it's so cheap here? Oh, because lovely Victoria is paying thousands of pounds to train here, and because she's paying that to inject you, you get that at a slightly cheaper rate, and I'm here to supervise.
Yeah.
Of that, though, you're doing a brilliant job.
Thank you.
You know, and it, you know, so it's all right to ask the question, because if there's a very good answer, and sometimes, yeah, it's cheaper, but unless there's a very good reason, it is a massive worry. People buying things from, you know, Korea and getting them imported, you know, and they're rat poison, they're not toxin, and they're injecting it into people's faces. It's quite concerning.
Yeah. At the end of the day, our prices are what they are because we are professionals.
Yeah.
And we will see you throughout your journey, whether it goes right, goes wrong, needs adjusting. We're here to see you all the way through. We're not going to say, oh, I don't deal with complications, you need to go down the road to see somebody else. You won't get that.
But it's like, I've heard recently a lot of practitioners around where I am, oh yeah, I went to see this person because they're a bit cheaper than you, and I'm like, oh, okay, I'm not interested in where they've been. How did that work out? Oh, well, I wasn't very happy, I had a wonky eyebrow, and they wouldn't review me. There's your extra £50, because I would have reviewed you, and if I could have rectified that and perhaps injected other muscles to counterbalance it and return the symmetry, which again is advanced complex training that I've had, which I've paid for, which is why my prices are probably slightly higher, then I would have. And if I couldn't, then I would refer you on to someone that could. And oddly enough, my insurance will pay for that.
Yeah.
You know, and I think it's about that. I think, yeah, you're exactly right.
And that's something I wrote on my yesterday. I said, you've got to be careful with these bargains, because you're not getting, there's no such thing as a bargain. All you're doing is bargaining with your health, your safety, and essentially your faith.
Yeah.
And it's the same face you're going to look in the mirror every day that everyone else is going to look at.
Yeah.
Would you cut corners with anything else? Probably not. And it was like I said to you the other day when we were talking, I said, I was talking to someone from marketing, and he said to me, I'm going to get you on a plane to New York. It's going to cost you £50. What's the first thing you say? And my first question was, what's wrong with that plane?
Yeah.
Exactly the same.
Yeah. And it's difficult because, you know, there is a thing about marketing, there is a thing about doing discount treatments, you know, and businesses do have to survive, especially small businesses. But there are ways and means around that. You know, it is against the law to advertise toxin, and especially for an offer. It's not appropriate to entice people and offer offers on cheap filler, because, you know, ultimately this is their face. And what are we cutting our price on here? Are we using a cheap filler that hasn't been CE marked, it hasn't been MHRA approved, it hasn't been through clinical trials? And I remember when I first started, I went to a conference and I was asked, could you try our filler? And I said, all right, yeah, how much is it? They said, oh, it's £30 a mil. I said, no, thank you. Where's your clinical studies? Where's your evidence of safety? Where's your CE mark signed? This product did hit the market, lost its CE mark 3 times. I've never used it. I could not sleep at night injecting a product into someone's face, knowing full well that it didn't meet all the safety aspects, hadn't been trialled. If that product was any good, somebody would invest money into it, as we all know, even Alan Sugar maybe, they would invest money into it and it would be a multi-billion-pound business all around the world. If they're not investing money, there's a very good reason, but yet you see practitioners all around the country going, oh yeah, I'll buy that, it's £30 a mil, and I can inject your lips for £50 because I only paid £30 for my filler. Okay, well, have you incorporated in case you need to dissolve the filler, in case there's a problem? Have you incorporated a review in case they're concerned? No, you haven't. And that's like I'll say to my patients, I will treat you, this is the price. Any problems, side effects, complications, anything not quite right, review required, all included.
Yeah, absolutely.
For 7 years, I've had very minimal, if any, complications, problems and side effects. And I'm confident that I'm well trained, and granted, things could go wrong tomorrow. I've just done some tear troughs, you know, there might be a problem with those. I'm hoping that there isn't, but I've injected a lot of other things where there haven't been. And I'm confident that then if that patient does have a problem, that's fine. We've got the finances, the skills, the pathways, the networks and the insurance to deal with it.
Yeah.
Yeah, and so yeah, going back to this filler, yeah, that filler isn't around anymore. It's not around. It's funny that, you know, and people say, oh, you know, is there a cheaper filler that you could use but still inject my face? And I'm like, no, I use this filler because it's had all these trials in a safe environment, and I don't want to use my patients as guinea pigs. I don't think that's fair. Oh, let's inject this. It's cheap. I'll give it to you cheap, and let's see if you end up with massive hard lumps under the skin and granulomas or swelling that will never go away. I'm right. I'm just not what I'm here for.
No,
I want to help people feel good, not look and feel terrible.
Yeah, I mean, every filler I purchase will come from a reputable pharmacy where they've checked my license, they even checked my passport to make sure I know who I am.
Yeah.
They can look exactly where that product has come from.
Yeah.
And I know all my reps.
Yeah.
I have their mobile numbers. So if I have a problem, I can either call the pharmacy or I can call that rep and I say, hi, we have a problem.
Yeah, exactly. And I'm reporting it to you because there's a problem with the product, or obviously we do our assessments, we make sure that we haven't missed anything with the patient in taking the history.
Yeah.
You know, and sometimes I've known that to happen, not with myself, but I've known that with other practitioners. Something's been sort of overlooked and then that's caused a problem. But ultimately, yes, if it is the product or there is a new side effect that's been brought to light, then that needs to be reported to the company so that they can investigate it appropriately. And those companies have that support and they understand that that's important.
Yeah. There's no cutting corners. You can't cut corners. If you're cutting corners, you will be running into problems.
Yeah.
Well, I think we've ranted enough, Natalie. Because once we get going, we just keep going.
I know.
Is there any questions at all from anybody that's been joining in? I don't think there has been. I think they've just been listening to it, hopefully absorbing all that wisdom.
And it's been a while since I've done a live, and normally at the beginning I would say, you know, if you've got any questions, pop them in the box, let us know. I think it's key to just, if anyone wants to ask any questions, please put them in the box. But key to also just touch on the key points of making sure that your medical professional is a registered medical professional answerable to a governing body. Check them on their on the register. Ask for their registration number so you can check what qualifications they've actually got. Ask to look at their insurance. Absolutely. What does it cover? You know, and when they say to you there is a risk of blindness with filler, okay, what's the risk? How does that get managed? If you think you may have blinded me or there may be a problem, what then happens? You know, I always say to my patients in consultation, if I'm concerned, this is the pathway we follow, these are the procedures I've got in place, this is my network, these are the people I know, these are the people I'm going to call, clinic gets cancelled, we get on a train and we go on a little journey and we aim to sort that out. You know, and just reassure people that there is a plan. We don't just panic and go, oh, don't know what to do, sorry.
I think, from, especially at the moment, with there not being the regulation that there should be clued up.
Which is coming.
Don't be frightened about asking questions.
Yes.
You don't get the right answers, or you find they're avoiding your questions,
Yeah.
move on.
And also as well, you know, I hear a lot of people say, oh, you know, you've come recommended. And I go, okay, do you know anything about me? No. So I know you trust your friends. I know you see their lipstick and you like it. I like yours today, by the way. It really suits you. Brings out your eyes.
Yeah.
But how do you know your friend has checked those things with their injector? You don't. And you know, friendships are good, and I'm glad you're bonded, and I'm glad you're strong, and you trust your friends, and that's good. You should always have a good group of friends around you. But I think if you actually all sat down and talked about it, you probably wouldn't all go to the same injector. And it's really important to, yeah, like we were saying, just to ask those questions.
Yeah, absolutely. Because someone that's honest and open will give you the honest and open answers.
Yeah, absolutely.
And that's what you're looking for. You need to have a good relationship where you can ask those questions and you know that person has your back.
Yeah.
And that's what it comes down to.
Yeah,
you wouldn't do that with anything else.
No, I always say to my patients, if you're not happy, let me know, you know, because it might be something that I can tweak really easily. I'd rather you let me know than you went and told someone else and never came back.
Yeah.
You know? So being open, honest, transparent, accountable, responsible, appropriately trained. And when I say appropriately trained, so regulation is coming in, as we know. It's probably going to take 2 to 3 years. But the Department of Health and Social Care are working with or alongside the JCCP and lots of other industries, and the BCOM and the British College of Aesthetic Medicine for doctors and for nurses. And there will be a framework of standard qualifications, gold standard qualifications. There will be a process. There will be a licensing scheme is the projection. So everybody knows who is injecting, where they are, what qualifications they hold. The plan is that there will hopefully be the register, and anyone can be looked up on it to check that how well trained they are, that they're insured, that their premises is appropriately clean, at a very bare minimum, and is appropriate for an injection environment.
Yeah.
Bring it on.
Bring it on. I'm ready.
So on that, quickly, so you're doing toxin treatments, filler treatments, and skincare, aren't you?
Yep, I will do a full premium skincare consultation, as well as providing high street alternatives if there is a budget to work from.
Yeah.
I will then follow that person up every 4 to 6 weeks to get in to make sure we're in the right journey towards getting the right results. I do microneedling, I do chemical peels, I do skin boosters, I do dermal fillers, I do Botox. Yesterday I was doing Profilo. It was wonderful. I had a great time. So that'll be coming soon. And polynucleotides are coming soon as well.
Yeah.
So I am raring to go.
And highly recommended by me, by the way. So I've worked with Victoria in London at Harley Academy, and I've seen her inject, I've seen her consult, I've seen the way that she engages with the patients, how she is genuinely honest and ethical and very well trained in her NHS job as well as in her aesthetic job, and I think we'll do very well.
Oh, thank you. And I'll be continuing to harass everyone down at Harley Academy anyway.
No, good. You can do me a chemical peel, actually. I've just had one. I'm peeling a little bit. Sorry, everybody.
Oh, I didn't notice. I thought you were just glowing.
No, the peel has been real this week. The skin has been falling off left, right, and centre.
Honestly, once I give birth, I am booking myself in, and I'm just going to let everyone go. I'm all right. Bit of pelvic kind of pain and aches and pains because I'm only 5 foot and I think I'm giving birth to an elephant. But apart from that, I'm fine. I just, hormones, a little bit of acne occasionally, all the glamorous stuff. Someone said to me yesterday I was glowing. I was like, it's not glow, it's sweat.
It's sweating, a little bit of flushing from my hormones.
Yeah, exactly. So I'm already prepped to go into Harley Academy once I've popped the baby out. I actually said, because I'm due on the 7th of June, but I said on the 8th I will be in Harley Academy waiting at the door for them to open and be like, right, hit me. I I need everything.
Oh, bless you. You look great. You look really good.
Oh, thank you. Well,
But on that, there's another good point. Any ethical practitioner, medical or not, wouldn't normally treat a pregnant lady.
Yes.
Just because of the lack of evidence. There's lack of it. No one pregnant says, inject me with all these things and see if there's any problems. And it's not that the drugs that we inject and the products that we inject aren't safe, because we make sure we use ones that have had all their checks. It's about, if it doesn't quite go to plan, the drugs and the things we need to use to rectify it. And those are proven to be detrimental to an unborn child and also a pregnant mother. And that's what I make quite a point of. People say, oh, I don't mind. No, I do. Yeah. I want your baby to come out beautiful with absolutely no problems, and there's no way I could inject your face or your body knowing that there is that small risk and we can't prove otherwise. And it's not worth the risk. No, it's not.
For 9 months, it's really not worth the risk.
And
pop the baby out, then book yourself in. As long as
any ethical practitioner that cares about the health of you and your baby will not be thinking, but it's £200, or oh, but it's £300. It will be a flat no. Sorry, my policy is I don't treat pregnant women. I don't treat women that are trying to get pregnant, and I don't treat women for ideally at least 6 weeks afterwards, unless it's like their 7th child and they had a natural birth and everything was fine. But it's very rare because of the hormone changes that affect the skin, the muscle laxity, the ligament laxity, which affects the face. We need time to recover. We just need, a little bit of a rest.
No, exactly. And as you know, I'm very happy to tell people no, which I have done already. But that's a sign of someone that knows what they're worth and also what is actually appropriate and what isn't. They've got your best interest at heart.
Absolutely. And it's weighing up the risk versus the benefit.
Yeah.
And if the risk for you as a patient is high, then it's high for me as an injector. Do I want to take that risk? No. There are some surgeons, some doctors, some nurses that do, and that's fine, and it works out beautifully. Jolly good. I'm all right. I don't want to do that to you. Same as I don't inject people, and I think you're the same, 4 weeks before they go on holiday or a special event. It's common that you might get a small little bruise or even possibly a big one from some of our treatments. These are the blood vessels of the face, which I've got here in clinic.
Ooh,
blood is everywhere. It is everywhere. It's not just here, and there's not just a vessel here. It's everywhere. It's all linked. It's all attached. And I don't want you walking down the aisle with a black eye, because that would be terrible for you. I would be horrified. And then second to that, that would be my business in tatters, because everybody would know that I did it.
Yeah.
I'm all right.
I'm all right. Don't need
I'm all right. Just keep away from me when you're getting married or you're having a big birthday. Just give it 4 weeks, please.
Yeah, no. And that's one of the things I do, because I do wedding packages where I tailor everything. I do it from your wedding day backwards.
Yeah, brilliant. And people come to me, like last year I had an influx of people in like March. We're getting married in May, June and July, and most of them I said, can't treat you, sorry. Why? You've never had the treatment, you might not like it. I want you to have it at least once, especially if it's an injectable. Give it a few months, take photos of yourself, go out, see what people say, see if people notice, see if you like it. If they don't, we'll get rid of it. Before you then get your wedding photos and go, oh my goodness, why did I do that? And that's rare because I'm quite a natural injector, as I know you are. I like to restore, rejuvenate, beautify with what we have. I don't like to change profiles and proportions. I don't like to overfill. I know you're the same. And yeah.
But
sorry, I got to the point where I was like, I think I made my point. I'm just going to be quiet.
I think I made my point. I'm done now.
It's been a long day. It's been a long day.
Well, speaking of a long day, I'm sure you've got plenty more people to see. So I will let you be. Thank you so much, Natalie. I really appreciate it. It's been absolutely fantastic speaking with you.
And you.
And if anyone's got any questions, you can DM me. I'm available. I'm just sat here pregnant eating tuna. So
but still comes highly recommended. I've seen Victoria inject. I've seen her treat, I've seen the way that she manages her patients, and I highly recommend her. So get yourself booked in.
Thank you so much. Have
Take
a
care.
wonderful weekend, everyone.
And
Thank you,
you.
Natalie, and
Bye.
we'll see you soon.
See you soon.
Bye.
Bye.